So, hello. Thank you very much for being here with us today for this press conference where we will go over the additional measures for the school network within the framework of the COVID-19 pandemic. Together, we are with Jean-Francois Roberge, the Minister of Education and Higher Education, as well as Dr. Richard Massé, who is the Public Health Strategic Medical Advisor at the Ministry of Health and Social Services. They will be speaking one after the other. Without any further ado, the Minister for Education, Monsieur Jean-Francois Roberge. Thank you very much, and thank you for your presence, Dr. Massé. Thank you as well to all those who are listening to us. Hello to all journalists. First, I wish to wish everyone a Happy New Year, since it is the first time that I am publicly speaking at the beginning of this year. Particularly a good year to students, to whom I'm always thinking, who are always present in my mind, but obviously, Happy New Year to all the school staff and of the ministry and everybody who works in the school network, including, of course, the parents who are essential partners. Today, it is important to go over the situation in our school network. The Premier, 2 days ago, announced the date that we're going to go back to school. So as of Monday, preschool and primary students are going to be going to class, and a week later, on the 18th, it will be the high school students, as well as general adult training and professional training. But of course, once the dates are announced, a lot of questions remain, and I will be very happy today to be able to answer those questions and give clarifications. But just before, I think that we have to put into perspective the decisions that we are going to be making today and what is going to be happening in the upcoming weeks and months in a broader perspective, looking at the school year in general speaking, and also what's been going on in the school network since the beginning of the pandemic. It is important to remind ourselves that we had a pretty successful fall on the academic front. Of course, it wasn't perfect. It wasn't possible to have absolutely no problems during a world pandemic. But the plan that we filed in June of 2020, which we updated in August, allowed us to keep our schools opened throughout the fall with a very particular specificity which took place in Quebec, and it was not the case everywhere in Canada or the industrialized world. We kept the national priority on education and also mandatory learning in school. And in all those conditions, throughout the fall, 98% of classrooms remained opened. And that is exceptional. And I think that it's important to say that that is a challenge that we met as a society with people in the school network. So we met that challenge. And of course, after the holiday break, people wondered, okay, but are we going to reopen the schools, and when? Very clearly, I think that there's a pretty strong consensus in Quebec to say that we have to open them as quickly as possible. I've seen interventions of the Pediatrics Association that also goes along those lines, specialists in education, all the partners of the school network, parents, and a lot of students as well said, I want to go back to school. So we want our young people to be at school. But of course, we can't pretend that the pandemic doesn't exist. We have to adapt ourselves, and we can see with the cases that we have in Quebec, the community cases, that we're upon hard times. So we have to do things differently. That is why today we are going to be announcing an updating of the school plan with information that will be valid until the end of June. Essentially, what I like to say is that it's good news. So we have additional measures that are going to help from a teaching point of view, from a health point of view, to make sure that the safety and health of all those who are in the schools is protected, as well as measures to take care of the people from a mental health point of view. And it's important to mention this. The objective is to reduce pressure, amongst others. Reduce pressure on the network, on parents, and on students. The school teams are doing formidable work, but everything can't be on the backs of teachers and parents. We also have to give all of these people help. And that is why we're announcing that we're going to be setting up over the next few weeks, by the end of January, tutoring formulas that will help our students that are having difficulties, that are perhaps but that have perhaps had difficulty. So we're going to have a recruitment platform that worked really well in the fall that is called Répondez Présent. So we'll be using it again. So we're going to be making a call out soon to voluntary staff in our school system, to people who are retired from the teaching network, and also our students in colleges and at university, particularly those who are getting ready for a career in the education world. Those people will be able to become tutors and therefore help and support students that will have been targeted by their teachers, those who best know the needs of their students. On top, with partners, we are going to be launching pedagogical discussion forums. They will be online and they will be available to help students who need support, so outside of regular classrooms and even beyond the tutoring programs. We cannot forget about mental health either, of course. There's school success, but there's also educational success, and there is a general state of mind of our students, and we can't forget that, and that is why very soon there will be a mobile app that will be available that will allow our young people to have access to numerous resources, as well as testimonies, chatting videos to help our young people get through this stressful period, break isolation. And with the mobile app, I think that we're going to be going where the students are very often, that is on their phone, which is the means for them to have access to all sorts of resources. Now, a word on the evaluation of learning. As we know, usually there are 3 report cards in a regular school year, but now we're not in a regular school year. We've already announced that this year there was going to be 2 different stages, so 2 report cards. The first one was supposed to be emitted at the very latest the 22nd of January, but with everything that we've experienced in the past fall, with the break over the holidays, there are people who asked for an extra delay. So today we're announcing that, yes, it will be possible, if necessary, to wait until the 5th of February in order to give the first report card. But we also have to look at how the report cards are weighted, because, there's one per report card, another one, and then there's a global result, which is made of the compilation of those 2 marks. So I'm announcing today that there will be a different kind of weighing. We are going to be reducing the value of the first report card and increase the value of the second report card. And now I want to speak directly to the students. If you had good marks, if despite everything that happened, you had good results and you succeeded in learning, so much the better for you. Those good marks are going to remain, and you have everything that you need, of course, to succeed in the second stage. If you had a hard time, if you had delays, if you're worried with the marks coming up in the first report card, well, I want to tell you, don't give up. We want to keep you motivated by giving more importance to the second report card. We're giving you the opportunity to catch up. That is the objective, and that is why we're making that decision. Something else that I'm announcing today to make things lighter is that we're going to be cancelling ministerial exams, what we call ministry tests, or secondary 4 and 5 exams. They will not take place this year, because it's an exceptional year. We're going to be canceling them, but we're also going to make them available at the end of January, documents that have been required by teachers in the past few weeks. That is a document that brings together things that are musts, essential things that must be taught so that the young people succeed with their school year, but also so that they can start next year with confidence. So canceling ministerial exams, and this document of essential knowledge also is going to be lowering pressure. So we're going to be demanding, of course. We can't, we cannot, we have to make sure that we have high standards, but we also have to show goodwill this year. We are putting together exceptional measures because we're going through an exceptional year. Other measures are going to be set up for the next few months for the upcoming year and even for the school year. The 122 school year. We're going to work together with school boards, with unions, with all our partners, because we want to see things in the middle and long term. And I think that it's also reassuring to know that we're planning for a teaching continuity over more than 1 year. But let's come back to the short term, what's happening this week and next week. Another good news that I'm very happy to announce to you is that as of next week, all students of Quebec in the public network will have access to technological tools, so either a tablet or a computer, if they need it. Not only high school students, but also primary. And this is something that we can succeed in doing because we've been proactive. We have found $150 million. We ordered this in June. We received a lot of material this fall, and we still are receiving things. So as of next week, 100% of needs will be filled. So whether it be in high school or in primary school. A word on air quality. We've talked about this a lot lately, the quality of air, ventilation in schools. So I want to go back to this question and go over it, of course, with Dr. Massé, who is going to talk to us with his expertise about air quality. At the end of 2020, we asked for tests to be done in order to measure CO2 levels. And we're told that CO2 is an excellent indicator of the quality of ventilation and the air exchange, how much fresh air is brought into a place. So we measured CO2, 330 schools. All classrooms were tested 2 or 3 times each, and the results are pretty encouraging, I would say, and pretty reassuring. First, I want to say that in Quebec, that the ruling on health and safety tells us that in a workplace environment, we can tolerate levels of up to 5,000 ppm, so parts per million of CO2. It's pretty high. In the school network, it's a lot more demanding. We protect a lot more, so it's 1,000 ppms. We don't want to go over 1,000 ppms. And the sampling that we made gives us an average rate of 804 ppms, so 20% better than the limit that we have, which is already very demanding. So that is the result of the very serious sampling over 330 schools. So it is, of course, something that is very reassuring, but it's not perfect, it has to be said, because when we have an average, it doesn't mean that it's all the results that are the same. We have about 3% of the locals that were tested that present problems, and for which measures very often have been taken already as of December, and more measures will be taken very soon, very often before the arrival of the students. So corrective measures will be brought either by adjusting the protocol of the mechanical ventilation system or the opening of schools, not schools, I'm sorry, but windows and doors. And I want to clarify something. If ever we can see that it is not possible to ventilate and air out a specific room, we'll use them for other things. They will simply no longer be used as classrooms. So I think that this is very reassuring. Also, I wish to specify that following a recommendation of public health in the report that I'm making public today, all schools will be tested. All schools will be tested to evaluate the CO2 levels, so the effective quality of ventilation in all school establishments. So these are additional measures that have to be taken because of these tests. If additional measures have to be taken, they will be taken very quickly. But I repeat it, the test that we did, the sampling shows us a level of about 804 ppms, which is encouraging. I would like to talk about the last additional health measures that allow us to reopen the schools with confidence, on top of the measures that we already had in the fall. 5th and 6th grade schools or students, as the Premier said, will be wearing a mask even in the classroom. From 1st to 4th year, they will have to wear a mask in common areas, in hallways, and on buses. But I want to reassure everyone, we're not imposing the mask or face covering outside, for example, in the yard. We want the young people to be able to run and jump, and of course outside the risk is not nearly as high. So no masks during recess. So for high school students, professional training and adult training, as of back to school, they will have to wear procedural masks. Before it was just face coverings, but following a recommendation of public health, we will be supplying 2 procedural masks per day per student. That is an extra protective measure. And Dr. Massé will be able to talk to us about extra measures as well, having to do with vaccines. So, as we can see, the situation is far from being normal. This situation is demanding, but we do have the necessary measures that allow us to be able to keep our schools open and to prioritize education as we've been doing since the beginning. So, we have a clear and solid plan, the fruit of many consultations, and that, of course, have to do with school, health, but also mental health. So, at the end, I wish to put the emphasis on the formidable work that is done by all the staff of our schools. First and foremost, of course, our teachers who teach sometimes in person, sometimes online, remotely, but always professionally. I wish to put the emphasis on their work because it's thanks to them, but also thanks to the participation of all experts. For example, the people from the Tactic Committee that I consult very frequently, and all the partners that we have managed to set up all these great measures that I announced today. And it is thanks to all these measures and the work of the people in the field that the year 2021 will be, I wish it, and I sincerely think so, a year of education success that we will vanquish COVID together. So 2021 will be the year of hope. Thank you, Mr. Roberge. Mr. Massé, the mic is now yours. Thank you very much, Mr. Roberge. Ladies and gentlemen, first, I'm happy to be able to be present for this announcement for the Education Network and to be able to present certain of the recommendations of the report on ventilation and the transmission of COVID-19 in a school setting and care setting. Everybody's very aware of the important interest that air quality has in these different places. There's been a lot of discussions about this, and that is why the Health Ministry has mandated an expert group, about 20 different experts, including 6 external reviewers who went over the scientific knowledge having to do with the transmission of COVID-19 together and how it is linked with ventilation, and also to support the decision-making process of authorities in the maintenance of the ventilation system and the protection of people from this kind of transmission. So the report should be online today with a summary. It was based on works of the National Institute of Public Health, to whom we had already asked last summer to have a look at this because we could see that there was knowledge that was important about this. And as was done elsewhere in Canada, in Europe, and the United States, we looked over all the literature, and there are 3 documents from the Institute, support documents from the Institute that are also available online at the same time. One that has to do with transmission of COVID-19 through the air and through aerosols. And the second has to do with the ventilation as such and its role. And the third has to do with the prevention of infections that could be associated. So the infection prevention mechanism. As these documents show, we can see that the notion of aerosols, that is small particles in the air, so smaller than 100 microns, can move around. And as we mentioned over the past few months, this transmission is done most particularly over short distances. So we're talking about the 2 meters here. So it is within 2 meters that the very vast majority of transmission is done. That being said, there can be circumstances where there can be a longer distance transmission. For example, when people sing, when people yell or speak very loudly, when they cough, when they sneeze, all those circumstances can make it that those droplets can be present, these very small droplets which can travel further. But we're not talking here about a very long-distance transmission. They do not remain suspended in the air for a long time, as we can see for other diseases like tuberculosis, where the transmission can be done over a longer term. The transmission risk is increased under certain circumstances. So once again, you will see things that we've been mentioning for months. For example, in restrained spaces because people are closer together. In places where there's a high density of occupants, for example, when there's many people in the same room. When there is a prolonged exposure, we've often talked about 50 minutes and over as being an indicator of that prolonged exposure. And obviously, when those places are not well ventilated, while those particles that are suspended in the air accumulate. The experts have proposed many recommendations based on those, so general recommendations, but important ones. The first one is that respecting the requirements for air quality as they are defined in the laws, for example, the Act on Health and Safety and Workplace Safety, but also in guides, the Ministry of Education guides, health guides, and that these respect international recognized standards. So the first recommendation is that we follow these standards and that we respect them. The second, and that is what was mentioned by Mr. Roberge a few minutes ago, is the fact that there must be systematic inspections done in order to measure different parameters, CO2 being one of those indicators that gives a general number, but as needed, many other indicators can be studied as well, and that will be done on an annual basis, ideally before the winter period. But what I hear, and I'm very happy of it, is that the Ministry for Education is going to complete the study that it made with all of these. Thirdly, and that is also has been announced, when there are anomalies, there are corrective measures that have to be brought very quickly, and that there is systematic monitoring to be done in rooms where ventilation is deficient. So it's not about, having a look at it once, measuring it once. But when we see that there are anomalies, well, then we have to make sure that things are put back in order and that it is monitored. Concerning more specifically the education network in schools that are ventilated naturally. In the education network, there's about 3,300 schools, if I'm not mistaken, and I'm rounding them up or down, but about 2/3 are ventilated naturally. So there are measures that had to be taken to increase the fresh air uptake. And amongst those measures, we recommend opening doors, windows at the end of the day, before classes and between class, and even in the winter periods. Of course, if it's very, very cold outside, well, people will perhaps adjust, but it is essential to ventilate for a pretty long time in order to be able to have fresh air intake many times during the same day. Secondly, leaving classroom doors open as much as possible. It can have certain inconveniences because it can be more noisy, but we believe that for air quality, it's something that will be helpful. Thirdly, obviously, avoid using classrooms that are not ventilated or badly ventilated as classrooms or meeting rooms, because we're talking about classrooms, but it's not just that. There can be rooms where teachers or other workers get together, and we know that it can happen that these are places where infections are transmitted. That also has to be taken into account. We are conscious that there are constraints as far as the availability of the classrooms are concerned. So if, for certain reasons, these rooms that have bad ventilation should be used, well, then systematically we'll have to limit the number of people and to limit them significantly. So 50% or less of the number of people that will use the rooms. So the use of those rooms should be temporary until another room can be found in order to be able to work. And the health guidelines must strictly be respected. Many discussions as far as the air purifier is concerned. These are mobile filtering systems that recycle the air that is within a room. The expert group does not recommend the use of these air purifiers inside classrooms in schools. Even though there are a lot of people who talked about it, even though there are perhaps some schools that bought them, it is not a recommendation of the expert group for many reasons. The first is that it has not been shown that these air purifiers were able to limit the transmission of infections by aerosols. It does not mean that it can't filter the virus and bacteria. It doesn't mean that the filters do not have a certain level of efficacy, but there's a lot of different models. But it just means that it has not clearly been shown that it can reduce the transmission of the disease. Second, and the second reason is very important, it's made to, work at small distance. These are droplets, so very close to the person that emits those droplets to be able to take them and filter them. So in a classroom, we don't know. In a healthcare setting, we know who the people are who are infected, or there's a lot fewer people. So we are able to know, where it would be needed if it is needed. But in a school setting, people who have symptoms shouldn't be in school in the first place. People who are infected shouldn't be in school. So by definition, we don't know who it is. And setting up a machine in one place, in one classroom, it is proven that it's not enough. It has to be close to the person who might be emitting those droplets that might infect. So it would be giving ourselves a false feeling of confidence. There would have to be purifiers close to almost everyone in order to think that it might theoretically be efficient. So it's efficacy that is reduced in a bigger room. And for a classroom, one machine in a classroom is not going to fix anything. Thirdly, it can create air movements if it is not oriented correctly, if it's not done by somebody who really is able to monitor its installation. It can create air movements which themselves can resuspend aerosols. So that can provoke a risk if it's not placed properly, not set up properly. So people shouldn't be able to move it around. Fourthly, it can provoke noise. It depends on the machine. Some are more or less noisy, but that can hurt people's concentration. And fifthly, if we put these machines in class and people think that the other measures are less important, that they can come closer, that they can occasionally remove their mask, that they can be less careful with the contacts that people have between people because it creates a false feeling of safety, well, we're not following the message because it is clearly the other preventive measures that are efficient and that are the most efficient. So I don't want to neglect the role of ventilation and air quality within classrooms and schools. But that is not what the correct way of fixing the problem is. So if ever there were to be specific problems, there are other techniques, other approaches as far as ventilation that can be used, like air brought outside, so air uptakes, which is not the same principle as an air purifier. So that is why it's not recommended in a school setting. In a healthcare setting, there can be indications under certain circumstances where there can be a complement, but here it's a completely different situation. You'll see reports where people will say, and we've seen it, people said, well, we should use it, but people couldn't make the difference between a workplace or a healthcare place or education. So the experts here were very careful to distinguish these all. And these are different indications, different needs, and they have to be taken into account in the recommendations. It's not something that is applicable across the board. In the report, there are many recommendations, other recommendations that I'll let you have a look at, but of course there's one that has to do on the evaluation of these filtration devices. I'd like to talk of two last things. The first is, for many months now, for weeks, we have been looking at whether there is the flu transmission. We're in January. Usually in January and in December and January we see that, but the measures that were set up have certainly contributed to the fact that there is no flu right now in Quebec. It doesn't mean that it couldn't take place in the upcoming weeks, but right now there isn't any. However, we do have children who have respiratory symptoms. Since there is no flu, and there can be other viruses in circulation as well, but in as far as there is no flu circulating and that there are people with respiratory symptoms, and clearly there are not very many children that go and use screening tests and diagnosis tests in certain cases when people have symptoms, we ask all parents of children to have their children screened if they have respiratory symptoms, to not even wait for 24 hours. In the fall, we're talking about 24 hours, but it was because at the time we didn't want people to go get screening tests because it would have led to a lot of non-pertinent tests. But the present epidemiology, which could change in a couple of weeks, but right now it shows that there would clearly be a disadvantage. So it would reinforce the health measures that we talked about before, but there would clearly be an advantage that young people be going get screened and to go even if it hasn't been 24 hours. And in the context of back to school, we ask everybody, if children have symptoms, whether it be in high school or primary school, that they go get screened, to not go to school with symptoms, because there are chances, significant chances, that it might be COVID-19 infection. Last point, concerning vaccination. You know that the vaccination campaign started. It's starting little by little because we can only use the doses that we have, and we don't have that many, but these doses will be used well. So a series of priorities that have been identified, and I wanted to mention that for teachers in primary and secondary school, for educators in daycares, we consider that all of these workers, teachers, professors, educators, these are essential workers. We can see and we know that these are essential workers. Who could deny it? So they are going to be put on the list of essential workers. They're not going to be vaccinated before people in CHSLDs, of course, and health. You understand how urgent the situation is, but they will be vaccinated before people from the regular age group or whatever. So that is in the first half of the people who will be vaccinated. So I just wanted to mention it because we believe that it is important. I think that we've pretty much said everything that needs to be said about this.
Merci, Monsieur Massé. Nous sommes maintenant rendus à la période de questions et de réponses pour les journalistes. Compte tenu du peu de temps dont nous disposons, nous vous demandons, s'il vous plaît, de bien vouloir...
We will now be going to the question period.
Une question par journaliste. Nous allons d'abord débuter par les questions en français et ensuite en anglais. Et nous allons...
We'll start with questions in French and then in English.
Pour les journalistes à distance. Donc, nous débutons dès maintenant. Véronique Prince, Radio-Canada.
Oui, bonjour à vous deux. Je voudrais avoir...
I would like to, perhaps these are details that I didn't catch, but as far as the sample that you took in classrooms and schools to check the CO2 levels, you said that all of the establishments were going to be tested. So what I wanted to know was, how many establishments does that mean? And when do you think that it could be completed so that we get the results of the entire network? And if there are modifications to be brought, would you still refer to the budget of last spring that you had given? Thank you for your question, Madame Prince. Happy to hear you in 2021. Yes, there are over 3,000 schools in Quebec, and we've sampled 3,030 of them already. 330. So we are going to be testing all the schools of Quebec. It was pretty important to go at the beginning with samples that was sufficiently broad, and that included schools built before 1980 and after 1984, because there were changes to the standards, the building codes, as well as schools in an urban setting, in a rural setting. Anyway, so we have a portrait that is pretty fair right now, but we're not going to test every single school. We're not going to not test all the schools. It's a recommendation of public health, so we'll follow it. So we can start that series of tests as of next week. As of Monday, it'll take a certain amount of time to do all the schools, of course. But as far as the budget is concerned, I want to reassure people we are in direct contact with school boards and general administrations. So there's no issue as far as the cost that it could bring about. So if we didn't have the funds, it would be planned that school boards do have the funds. But if ever we didn't have enough funds to do those tests, the school boards could do it themselves, and they will be reimbursed. Last year, we had given that guideline, and afterward, we reimbursed over $60 million of what we call COVID costs because the school boards had done what had needed to be done, and then they were reimbursed. As a follow-up, I would like to come back to the vaccination calendar, because now you're saying that teachers will be able to be vaccinated as well as educators in daycares. Do you have any idea when it might be done, knowing that if we have all the doses received as scheduled in February, you hope to have vaccinated everybody from CHSLDs and healthcare? So at what time could it be that we might get to teachers and CPE workers? Well, it depends, of course, on the doses, but according to the calendars that were given to us, and if they are respected, it will be probably later in the session. So we're talking here about March or April, not before that period, because before there are the groups of people who are residents in private residences for the elderly and the workers who work there, people who are 80 and over, people then who are 70 and over, people who are 60 and over. And once we get to 60, that is where we'll be introducing essential workers. So the ones that will not have been covered until then. So it's before the 50% population mark, but there are many people who have very significant risks and who are going to be vaccinated at the same time as other essential workers. So we'll bring us to the beginning of the spring. You know, if we think of spring being the 21st of March, it'll be at the beginning of spring.
Oui, bonjour. Est-ce que vous m'entendez?
Yes, hello, can you hear me?
So
the first question, Mr. Minister, taking into account the report and the opinion of Dr. Massé that it could be that air purifiers might be hurtful, are you going to ask that they be removed, the ones that are in classrooms now? For example, in the English schools? What we'll be asking is an evaluation by experts, because what the experts are telling us, the ones that were consulted by public health, is that it can even pose a threat, that of installing air filters or air purifiers, because it can put back into circulation certain droplets. So what we had agreed with public health is that if ever, even after, if certain school boards absolutely wanted to install air purifiers, it would have to beforehand have a favorable note and a procedure that would be validated by experts and recommended by the ministry, but that are experts as well, that will be chosen in the team of our expert team. As far as the air purifiers that are already installed, experts, not people who sell those air purifiers, but experts who belong to the CNESST, I think, or the INSPQ. I'm looking at Mr. Massé so he can validate that those people can go on the premises and make sure that it is done according to standards. Thank you, Mr. Roberge. Follow-up. Mr. Roberge, I understand that I'm having a hard time understanding, because you're saying it's potentially dangerous, but a lot of classrooms have them now, and school is going to be starting. So are you going to have the time to conduct those evaluations before students go back to school, or are they going to, are the air purifiers going to stay there? Can I let Mr. Massé answer, please? It has to be mentioned. I have to mention, we do not forbid. We are not recommending. We do not recommend that they be installed for all the reasons that I've already mentioned. But we want that those that are there, and I'm not talking for the others, but those that are already there, minimally, they should be installed correctly in that they don't bring risk. I mean, they might pose a risk, but the risks can be limited if there is somebody that checks how they've been installed, how they're working, and that they supervise how they work. But we do not think that it's a good solution. It is not the solution that should be applied. Clearly, it is not the solution. The members of the committee on that were unanimous. 20 experts were consulted, and all of them mentioned the fact that in a school setting, it's not a good idea. Because if a classroom shows ventilation or has a significant ventilation deficit, there shouldn't be students in it. I think that's clear for everyone. And that there are other methods to increase ventilation rather than having those air purifiers with the inconveniences that we already mentioned earlier on.
maintenant à Stéphane Lévesque, ici média.
Bonjour, messieurs.
Hello, gentlemen. So Mr. Drouin was announcing that the teachers and staff members were going to be vaccinated in March and April. If there is contagion of COVID-19, have you given yourself a breaking point, scientifically speaking, that might make it that there might not be school in person if that point is reached? A breaking point that would mean that we are not in person? Well, what I mean is that if there's a number of cases, a number of contaminated students or teachers, that would make it that the recommendation would be to close down schools entirely. No, we're not at that stage. We have to make a difference between primary and secondary school because part of teaching in secondary school is already done remotely. And what might happen is that there would be an increase of that if ever the situation deteriorates. In the primary setting, what we're thinking is that the presence of children, of students, is essential for their learning, for their mental health, for their socialization needs. And then something that is very different would be required in order to say that there's no school, because being able to teach remotely for primary students is very difficult. It can't be done, at least I'm not of the teaching industry, but it cannot be done in a way that can replace the presence of students to start with. What is done, however, is that when there is transmission in a classroom, there's an evaluation that is conducted around the people in the classroom. There's screening done, and occasionally we recommend that the children are withdrawn for a period of for a quarantine period, and they can go back to class only after. So if there are many classrooms that have problems, it has happened, rarely, that we have asked for children to be screened in school or even to close the school down very temporarily, and those measures could be applied if it were to be necessary. But closing all primary schools and delay the year, we're not at that situation right now. There's a lot of other things that would have to be done before stopping teaching primary school. We're talking about an essential service here. It is clearly an essential service for all of society.
Merci beaucoup, Monsieur Massé.
Thank you, Mr. Massé. Let's go to Claude Écouté, TVA Nouvelle.
Bonjour à vous deux.
Hello to you both. First, I would like to know, in aerosol transmission report, it says that one of the keys to decrease transmission is distance, but there's a lot of schools right now where the students, although they're wearing a mask, are not at that distance. Is the question of half classes, particularly in high school, has it been talked about? And if not, why not? Thank you for your question. It is part of everything that was evaluated, obviously, but it has to be seen that in the risk factors targeted by the expert committee, it is an accumulation. So we're saying there wouldn't have to be too many people who are together in a place that is closed and not well ventilated. So what we are told, the result of the test of the sample is that in a school network, the ventilation, generally speaking, when we look at the average, is pretty good. There are exceptions. We talked about 3% of classrooms that showed problems, and we're going to be treated. We're going to deal with this as an emergency. And if we find any other problems, we will fix them. So we're going to be acting very quickly and even use those classrooms if necessary for other purposes. That's important to mention. The idea, what we've had since the beginning, is also to go with what we have, the classroom bubble, like a family. And we limit contacts between the students. We do it in primary school, but also we do it in classrooms and teaching alternatively. So the young people are present in school as in their class bubble, but the next day they're at home, but they get remote learning. So that means that there's a lot less contact between the students from class A or B because they're not even at the school at the same time on the same days. If we went with half classrooms, it means that there are teaching issues that are very significant. Because somebody who teaches on the premises teaches differently than when they teach remotely. And, we do give them training on, remote teaching because it's not just giving a class that we would be in class in front of a camera. It's not the same thing. It would be it's a different way of doing teaching, and it is a compromise that we're not ready to do because we're thinking about the school success of young people. I also had meetings with a group of students as teams over the past few months, and I asked them the question, and they talked to us about the isolation and the mental health. And they said, we're in our class bubble. We're always with the same 20 or 30 people, always the same place. And they're saying, my friends are not necessarily part of that bubble. So it closes contacts, very important social contacts, very important in high school. When one is a teenager, they're already limited by forcing them to have social contacts only with their class bubble. If they were to have contacts only with half the class, always, 10 or 12 or 15 people, it would add an extra stress and once again bring about even more problems of isolation and mental health. So I can't tell you that we're not talking about it. But as I said, there are teaching issues that are very significant and mental health issues that are very significant that bring us to take a lot of other health measures, for example, procedural masks and tests for the staff and not waiting 24 hours before consulting. So these are other measures that we can set up that will have a positive impact, we're convinced of it. So on the calendar year, we can see that that the report card is going to be on the 5th of February. Okay. What about the break, the spring break? Is that going to be maintained or will it be cancelled? Taking into account that there was a break over the holidays, but that we kept the classroom days for remote learning, there wasn't really any holidays taken. So we are respecting the school calendar. We're going to keep the spring break as planned, and I'm happy that you are coming back to that idea about the report card to give it later. I mean, the schools and teachers that can give a report card on the 22nd of January, they can go right ahead, but those who need more time, they can go up until the 5th of February. Thank you.
Est-ce que Madame Lévesque nous entend? On reviendra plus tard. Passons maintenant à Marie-Ève Moras, journaliste à la presse.
Bonjour, est-ce que vous m'entendez?
Hello, can you hear me?
Oui. Bonjour à tous les deux. Ma question est pour le docteur.
My question is for Dr. Massé. I'd like to go back to a question asked by a colleague earlier concerning a possible closure of schools. Does that mean that regardless of the number of cases in the community, the number of daily cases or the transmission rate in the community, schools will remain open? And the second aspect of that, on what criteria did you base yourself to authorize the reopening of schools? Well, of course, closing the schools is something that is going to have an impact on transmission between young people to parents potentially, and also grandparents potentially. But when we look where the transmission takes place, right now it is taking place within families and gatherings in families. Over 50% of the transmission is in those family settings. The school had and has outbreaks, which increased over the fall period, together with community transmission. So it's more a reflection of community transmission, but it is not necessarily, it's not necessarily the schools that are fueling the transmission in total. It's part of it. It reflects it, but it is not the main cause of it. So we believe that with the measures taken right now within the community to limit transmission, it will have an impact to limit transmission. We're not going to prevent it, but we will limit it. Once again, stopping primary school has other important consequences that are very significant. I mentioned it, over learning, over mental health and socialization that we talked about. And consequences over family organization, the capacity of parents to be able to work and to be able to be efficient. So now we have to weigh between essential services and learning that is necessary and the side effects and risks linked to transmission. Since it's not the schools that mainly fuel transmission, although they are part of it, but that transmission is mainly in families and partly at work and another 25% in workplaces, I think that we have to continue with the school services for a few weeks, as we did. We can delay it for a few weeks and make sure that we take all the measures to limit transmission, but stopping it entirely is a decision that would have many other impacts, and that would mean that we would stop the functioning of a good part of society by doing that. So it's a measure that can be taken over short periods of time, but over long periods of time, it's not that easy in primary school. It has a lot of consequences. So that's it.
Merci. Peut-être en sous.
Thank you. Perhaps as a follow-up, you called upon the students and teachers that have symptoms to get tested. Are you thinking about large-scale deployment of tests? No, not in schools, not at great scale. However, there's progressive deployment of the accessibility to saliva tests. We have to test and calibrate the machines because there's a lot of different tests, and we have to make sure that technically it works correctly. That is being done, but we have other tests other than just saliva tests that we can use as needed. So yes, we are deploying screening services when there are issues or even mobile units. There are many that were used when it was necessary, but the systematic employment of saliva tests is not something that is encouraged right now. However, what we want is for people who have symptoms, because now we have to make a difference between people who have no symptoms and those who do. We want for young people who have symptoms, we want them to consult immediately to be able to have tests, and that they do not present at school if they have symptoms. But that's true for people at work, and unfortunately we've seen people who go to work saying, oh, I have symptoms, but I'm going to go get tested, but I'm going to continue being present because I haven't had my results yet. That's not at all what we recommend. So we're not going to deploy things for everyone, but we're going to make the test available as soon as the children have symptoms, or the teachers, of course.
Passons maintenant à Marco Fortier, Le Devoir.
Bonjour tout le monde. Je voulais voir, Dr.
I wanted to know, Dr. Massey, you said earlier on that children who are in classrooms that are not well ventilated should not be there. I just want to make sure, in the 3% of the classrooms that had those problems, what percentage of classrooms were evacuated and which were not? And are parents and staff aware? I can go, since it's a sample that was done by the school network rather than by public health. Public health, of course, was aware of all the results, and they emitted recommendations, and they've put it in their reports. The classrooms that were seen as being problematic during the tests were targeted already by the school boards, and the ones that operated these tests. Even sometimes in the report of the test, we're already told which measure was already taken. It has taken place that in the test, the people sent us the information on the test saying, well, yes, we tested, but we recognize that that day, for whatever reason, the ventilation system, the mechanical one that was supposed to work 2 hours before the arrival of students, had not been activated. So we recognize that it was, of course, an error and that in the future it was going to be done. And so the situation was corrected beforehand. In other cases, we included it in the report, but it said we have to do the first test after having opened the schools, and after that there were 3 tests with opening, without opening, and there were tests that were done without following the protocol. So, of course, the school board said, well, we can see that upon the result of the test, we can see the importance of following the protocols, and it was applied and it was corrected. If the schools see that in operating upon these modifications, either by starting a ventilation system ahead of time or by opening the door or the windows, as the protocol says, if we can see that it's not adequate, that we do not get a CO2 rate that reflects good ventilation, and we use the classrooms for other things and no longer as classrooms, that is a guideline and it will be followed. Do we have any idea in classrooms where the CO2 level was high? Do we know if there's a correlation with outbreaks? Because everybody's wondering what really creates outbreaks in classrooms. Do you know if there is that correlation? We were not able to make a correlation because we didn't receive the data very long ago. We make them public now that we have them. School services have the information to know if there's an outbreak in a particular classroom, of course, and they are the ones that do the sampling. But of course, as we continue with the samples and the tests in 100% of the schools in Quebec, we'll have more often than not that information. And eventually it is possible that we will take other measures. But anyway, the solution is not to keep students in places that would potentially not be well ventilated. The idea is to ventilate things correctly or to use these locals or these classrooms differently. So there's no question of seeing that there's a problem and to leave classrooms in students in classrooms that are problematic. We either correct the problem or we use that classroom for something else.
Bonjour, est-ce que vous m'entendez?
Oui.
Génial. Bonjour à vous.
Considering that it is no longer advised to wait 24 hours to test and screen the children, what are the symptoms that should lead to those tests, and what age group is this applicable to? Well, this is for children that have respiratory symptoms, whether it be a runny nose, whether it be pain in the throat, the appearance of coughing, respiratory difficulty, fever. So all of these symptoms, and I summarize them, but all these, which can be the source of an infection of the upper respiratory tract, are indications to go get screened. And we're talking here about children from primary and secondary school. Of course, any other person that has symptoms should go get screened as well. But in this framework, in order to not wait 24 hours, we're really talking about primary and secondary school students. As a follow-up, I'd like to know what the exact weighing of the 2 report cards it is. You said that it was going to change, but you didn't say how. Yes, today we are. This is a request that came to us from many teachers, and this is therefore the way that we are responding. So for people who have a hard time adapting, so we're announcing that the first report card is going to have a less importance and the second one more. We're still consulting our partners, however, to define what the exact percentage is going to be. But what is important, I believe, is to say that we are going to be giving greater importance to the second report card to keep everyone motivated and give everybody the opportunity to catch up if there are results that are perhaps not what they were expecting in the first report card.
Passons maintenant à Normand Provencher, Le Soleil.
Vous m'entendez?
Oui.
Oui, alors, Monsieur le ministre, alors, avez-vous des indications?
Do you have any indicators as far as the success rate of high school students? We were talking recently about that a third were not going to pass. Yes, I saw those impressions or those numbers which came out from school boards that told us that they had made a few validations with teachers, and we were given the numbers that reflected concerns as far as the failure rate that would be higher for the first report card. I do not have that information, that it has been validated right now, but I did ask the ministry to have information as soon as the marks are in and that the first report card is emitted. So we'll be able to have information to be able to see the real effect and to what extent the success rate is not as high with this first report card as compared to the previous years. But of course, we have to wait until we get the report card to know what's in it.
Merci. Comme il n'y a plus de questions en français,
There are no longer any questions in French. We'll now go to English questions.
je débute avec Rob Lurie, CTV.
Good morning. Can you hear me?
Yes, we can.
I'd like to start with a question for Dr. Massé. Dr. Massé, can you just tell us in English why you are not recommending ventilation in schools?
Yes. In fact, I must say just before that if there's a serious problem with ventilation within a class or a room, this room should not be used for teaching or for gatherings. So it should change vocation, if you could say. And if there's anything that's been noticed, it should be corrected as fast as it can be. We don't recommend those filtration device. First, because it has not been demonstrated clearly that it's efficient to limit transmission. The second reason is that its purpose is really to protect close contacts with droplets from people that are infected, and it's not efficient on a larger distance. So within a room or within a dentistry cabinet, you can imagine that you can fix or use those devices very closely to where the emission occur. In a class where you don't know who could be infected, just putting one device in one spot is kind of impossible to be sure that it's going to be really efficient in any way, if even it is. The third reason is that if they are not really well used or well placed, they could by themselves generate droplets in suspension and carry them to other persons. So it needs really to be well installed and to be sure that there won't be any side effects. That's why we recommend that, if ever those things are used, they should be placed by professionals. Fourth, depending on the kind of device that you're using, they might be quite noisy, and this might create some issues over concentration of people. And the last one is really that it could create a false security perception by people that if you have that, then maybe you can relax the other measures. But clearly the other measures are the ones that are the most effective, the most important to protect transmission. So if it does that within a class, then you kind of reverse the problem. So this is why we don't recommend the use of those devices. There are other ways that you can improve, either by opening windows, doors, increase the input of fresh air. You can extract the air from the place, which is one of the other issues that you can use rather than those air purifier. And you can have air exchanger. So there are other things that you can place rather than putting one kind of what you could think as a magic bullet, which isn't, in fact.
And a follow-up question for the Education Minister. I just want to know what happens for the schools who have already purchased purifiers? Will they be reimbursed for those purchases for the school boards?
Well, it's recommended that those devices has to be examined by some professional, not the sellers or people who installate them, but some expert from Direction de la Santé publique or Institut National de la Santé publique. So schools should call to the minister or call to the Santé publique to be sure that they don't increase the risk with those devices.
Merci, M. Roberge. Passons maintenant à Morgan Lowry, Canadian Press.
Hello, do you hear me?
Yes.
Okay, perfect. I was wondering if public health recommended keeping the schools closed for longer than the government decided to do, and if so, why did you choose to go against those recommendations?
Well, there has been discussion over the different strategies and possibilities. And I must say that personally, I recommended that we don't close the schools too long because of the important side effects of closing schools, primary schools especially, but also the impact on secondary schools. But there have been discussions over how long should we or when should we reopen them. But we were favorable of keeping that interval as short as possible, depending on the epidemiologic status within the communities right now. So this is the discussion that took place. It's not an easy decision because you have to balance the risk within the community and the side effects or impacts for the parents and for the kids.
And just as a follow-up, what level of transmission in the community would it take for you to recommend schools to stay closed for in-person attendance?
Well, we didn't state on a specific level of transmission. Right now, we feel that the level of transmission is quite high, and that's why there's been a recommendation to have a curfew and other community measures to limit transmission. And we think that those community measures with the curfew are by themselves very good tools to limit transmission. And I add something which is very important: if people respect them, because the problem is not the fact that those measures are good or not. They are good, they are functioning, but if people think that the situation is not so important for them and for the others that live the consequences of transmission, then we are in a difficult status. So you have to be careful not to punish or impose very severe constraints on people that are not the cause of transmission. The kids are kind of victim in that situation right now. So that's why we want to place really the measures on the places where the risk of the higher risk of transmission occur. And this is not in primary school. I don't mean that there's no transmission. There are transmission, there have been outbreaks, there could be outbreaks still. We are taking all the measures to control them very rapidly, but they are limited and they are not the cause of the actual situation. So there's no specific level that I can point off at this moment to do that. Obviously, if there was still uncontrolled transmission, there could be stronger measures that would be considered by the government.
Merci, M. Massé. Passons maintenant à Elias Aboud, CBC.
Hello, can you hear me?
Yes.
Okay, first question, just for Monsieur Roberge, why was there not a greater option for online learning in this session for more people except for those children with medical conditions?
Well, at the beginning of this school years, we had some discussions and we've decided that as a priority for the government and for the nation, education should be mandatory and in place, in school, presence for the kids is mandatory because it's really, really important. We have the doctors, the pediatres says it was really important for the kids to be in school. Teachers, of course, said it loudly. It's really important. It's the best place for the kids. Of course, if within the family they have some medical issues related to the COVID, we can make those exceptions, and we did, and we did implement some online school teaching for those kids because they are in a family with some problems related to the COVID. But for most of the kids, most of the students, the best place to be is in school.
Okay, and just during this news conference, we have received a release from the English Montreal Service Centre or School Board saying that they will go ahead with the installation of air purifiers, and they essentially disagree with the report. What do you have to say about that, either Dr. Massé or Monsieur Roberge?
Well, I think it's really important to follow the recommendations of our health specialists. I think Dr. Massé and La Santé Publique did a really, really high-value work. They consulted a lot of specialists, and they came with scientific, with some scientific recommendations. I think it's really important to follow them. And they didn't say nobody can't install those facilities, those things, but they're not recommended. And I don't know if you want to follow.
Well, they are not recommended, and if there would be a school board that would want to buy them, they should have authorization, and that's what's written in the report, at the end of the report, that they should have the authorization by a tripartite committee composed of people from the education sector, people from the CNESST, the work board, and public health to give them either an authorization or not. And for those that are there, then they could provide an advice. It would not be that committee, though, but we could provide an advice on how to be sure that they don't have negative side effects for the persons in the class.
Merci. Passons maintenant à Félicia Parr, Global News.
Yes, hi, do you hear me?
Yes, we do.
Great. For a question for Dr. Massé, in the cases where air purifiers are already in classrooms, can an inspection tell if it's making things better or worse?
Well, they can look at how it's installed and to be sure that it doesn't create a risk on the way the air draft could bring up some aerosols in the room. So it's mostly to inspect them and to be sure that there wouldn't be any other side effects that could be related with the use of those apparatus.
Okay, great. And for Mr. Roberge, you mentioned earlier the pediatricians and those who wanted to see schools reopen quickly. But what do you say to the parents and teachers and students who are nervous about going back to school on Monday. The English Parents Committee Association sent out a survey where over 10,000 parents responded, and 63% of them were not in favor of returning back to class on January 11th. So what do you say to those people?
Well, I can understand that they are aware. Maybe some of them are afraid because we are facing like a crisis. We are not in a normal situation, of course. And everybody, you know, they go in social media and they read a lot of things. So it's normal that we have to comfort them and to tell them the truth. And the truth is coming with the science. And that's why we follow the recommendations of La Santé Publique. And I think it's important to say that we come with some new measures to be sure that is safe and secure to be in school. So with those new procedure masks in high school, with face covering will be mandatory for grade 5 and 6 at elementary schools. Face covering will be mandatory in the global area and in school bus. So those are new measures that can reassure that it's safe to be in school.
Merci, M. Roberge. Passons maintenant à Rin Brumer, Montreal Gazette.
Can you hear me now?
Yes.
Question first for Dr. Massé. I just wanted to know your opinion on the use of plexiglass barriers in classrooms, given the nature of aerosol transmission. Do you think they're effective and should be installed?
This is a quite interesting and difficult issue. I've seen classes in Asia mostly where there have been some plexiglass that were put between students, but at the same time as they were putting plexiglass, they were kind of putting the students very close one to the others. So I'd rather have a distanciation of 2 meters if we can respect that rather than make any barriers between the students. In some instances, there's been also barriers between the teacher and the students. And we know that other than in class, it occurs that people are using that and it's effective. But in terms of teaching, there are other side problems of using them. This is why we recommend masks, and I must recall that we are recommending procedure masks, which are not kind of facial covering tissue, which is really something which has a higher standard of quality, and this is why we increased the level of protection to the children in secondary schools. And it applies to the teacher, which already had a recommendation of using those procedure masks, which are kind of what we call surgical mask, if you want. So we think that this is something which should be effective rather than putting barriers in plastic between the children. As I said, what I've seen, I'm not saying it's not effective. I'm saying that it has other sides problem that we would not want to happen in our classes.
Thank you. And a question for Monsieur Roberge. Given that provincial exams for grades 10 and 11 will be cancelled at the end of this year, I believe, how will CEGEPs evaluate how children be accepted to CEGEPs or not?
Well, I think we can rely on the professional judgment of our teachers. We decided not to go on with those ministers' exam, but of course there will be some report cards, and I think we can have a good confidence of the professional judgment of our teachers, so they will evaluate all they have to evaluate, and so the CEGEPs will be count on the report cards.
Merci, M. Roberge. Dernière question, Alissa Rubertucci. Nommez votre média, s'il vous plaît, puisque je ne l'ai pas ici.
Hello, it's Alicia Roberge, City News, Montreal. Minister Roberge, I want to know why it was necessary for the government to provide these procedural masks. What difference is it expected to make? And I guess why wasn't this evaluated back when school started in September?
I will let Dr. Massé answer this question because it's a recommendation of public healthcare specialist.
Well, in fact, what we know now better is that those facial masks in tissue have variable qualities in them because until very recently there was no standard here in the province and in Canada. There are some countries like France where they do have standards, and in Italy they have also standards. We didn't have that, so we asked the IRSST to provide what are the necessary qualities of those masks. But they are not, right at this moment, they are not manufactured so that, some of them are quite good, very good. I'm using them. And others have little or no values. So that's why we think that we can use those facial masks in regular situation. Some are quite effective, but in terms of class, we want to reinforce using surgical masks, which have higher probabilities to limit the droplet transmission between people. We didn't recommend them to start with last spring. You remember the difficulties with providing those masks at a very, very larger scale than we used to. So there was an increase all over the world. There was some kind of battle in airports concerning the accessibility of those surgical masks. And in September, through the session, we did recommend more and more the use of those facial masks, but we think at this point that the transmission is high enough that we want to increase the step to something which is going to provide to secondary school persons a better protection. There's an issue of adaptation to the face of the students. So for secondary school, there shouldn't be too many problems. If they are too large a bit for the attachment of the mask, the people can make some knot on them and adapt them to their face, which is not the case for the people at primary school, where clearly we would need to have a smaller mask and provide them, which we don't have in larger capacity at this moment.
And you're saying that children are not the cause of transmission, but what about a number of adult and vocational centers across Montreal, Quebec that are expected to reopen January 18th? Why aren't they treated differently, considering the students that attend those schools are among age groups with higher transmission rates?
Yeah, well, when you look at the transmission, there's the first step that you see where there's an increase in transmission is around 9 years old, 10 years old. There's a first step there. And that's exactly some of the measures that we are providing using the mask for those kids. And then the other step is really it increase around 14, 15 years old. And this is why we are providing tele-teaching for those children, and we would like to have those persons be taught in presence, but because of that higher transmission, we think that tele-enseignement or tele-teaching is something which is going to decrease the risk. So we are following the curve of transmission to do that. And we know that people in secondary 3, 4, 5, it's not perfect, but it's possible to offer that kind of teaching with a level of quality of teaching for those persons. So we are kind of adapting the measures to what are the level of transmission that we see in the community. I want to come back on the issue of the transmission. The transmission in school is difficult to separate from the transmission outside the school, before and after. And the message is also beware, we are discussing about opening schools, but what we want to be sure is that people before and after and in between, if you include the lunch hour, that all the precautions are done there, because this is a significant time of gathering and transmission, and what we're seeing is that people kind of diminish their level of protection in those circumstances, which is not school time. It's kind of related to school time, but out of the classes.
Merci beaucoup, messieurs. C'est ce qui met fin
Thank you, gentlemen. This puts an end to the press conference. Thank you, everyone, for having listened.